We're back for Your Ears Only. I'm David Alpern.
I'm Catherine Herzog with this news quote. The clearest evidence to date that gut bacteria can help cause obesity. That was Michael Fischbach of the University of California, San Francisco, on a study showing that bacteria from thin humans can help reduce obesity in a test involving mice. Whether fecal transplants can help other humans remains to be tested. Now this.
I mean, even though I'm however old I am, I still remember what it's like to be 27, and I was convinced I'd live forever and I'd never get a hangnail, much less have a serious accident. And I think if young people can afford the coverage, they should buy it and contribute to a well-funded system with lower rates, if for no other reason than they will not always be young.
Former President Bill Clinton last week plunged back into the role President Obama calls explainer-in-chief, focused on the Affordable Care Act, health reform better known or knocked as Obamacare. What conservative opponents called a scam on healthy young people, using their insurance premiums to help keep rates lower for the older and more ill, Clinton outlined as essential for mandated private insurance to be financially self-sustaining.
But getting those young people and a majority of all Americans to shift from suspicion to support of the ACA is an uphill fight for an Obama campaign-related nonprofit called Enroll America. Working against confidence beyond many outspoken Republican leaders and a well-funded conservative campaign are problems within Obamacare itself. Delays of the insurance mandate for employers, of planned Medicare cuts and eligibility checks, and full functionality of state exchanges, where, as of October, individual insurance is supposed to go on sale, ostensibly at competitive low prices. To talk about the education effort meant to overcome these hurdles, for Your Ears Only, we're joined now by Jessica Barba Brown, Enroll America Director of Communications. Welcome to the program.
Thanks so much for having me.
Is there any way yet to measure the impact of President Clinton's pep talk, and how many more such presentations would you expect him to make?
Sure. Well, the former president, certainly has a way with words, and I think we will be seeing, more speeches, more on the airwaves, for the simple fact that a lot of the uninsured who stand to benefit from the new options that are starting October 1st, they still don't know about them. So that's really why we were created and what we're doing out in the community, which is to let the uninsured know that starting October 1st, they're going to be able to access new healthcare options through this health insurance marketplace. And we're still definitely getting that word out.
How big is Enroll America, paid workers and volunteers?
Well, we have now currently over 150 staff members, and most of those staff members are in the field. They are in our 10 states where we have operations up and going on the ground. And currently, we've engaged over 3,000 volunteers in our effort. This weekend, actually today, is our Get the Word Out weekend, and today we have over 1,000 volunteers participating in 200 events across the country, and they're doing things like knocking on doors and, manning tables at community fairs, making phone calls to their neighbors, and again, really to let the uninsured know that these new healthcare options are going to be available for them starting October 1st so that they can find a plan that meets their family's needs and budget.
How big a budget does Enroll America have to work with, and who's funding it?
Our budget is in the tens of millions of dollars, and our funding comes from a wide range of sources, everybody from charitable foundations, groups that have been working for healthcare access in their communities for decades, to individuals who feel passionately about this cause, to, the healthcare sector that is really working to get the public informed of these changes that are coming. And again, I think what's exciting about the way that we've set up the operation is that, we are investing so heavily in our field program because we feel like these one-on-one conversations are the best way to let people know that, there are going to be these new healthcare options available to them. And we're really having just the facts conversations about those options.
We understand that a major target zone is Texas, where opposition and the number of uninsured are both high. What are some of the other states topping Enroll America's target list?
Yes, Texas is definitely a big state with a lot of uninsured, and that's where we are focusing a lot of our operations. We also have on-the-ground operations in Arizona, Georgia, Florida, North Carolina, Illinois, Ohio, Michigan, Pennsylvania, and New Jersey. So we've really dedicated our resources in those states where we know that there are a lot of uninsured people, and again, that they have not been yet made aware of the opportunity that's going to be available to them to purchase these new quality, affordable health care plans.
Well, some aspects of the ACA are already in effect, such as letting young people stay longer on their parents' insurance. Do we know how many young people are taking advantage of that?
Yeah, actually, there was a recent study done by the Commonwealth Fund that showed that nearly 8 million young adults have already benefited from that provision, which is great news. And I think what's often missed when we talk about the young adults who are going to be enrolling in the health insurance marketplace is this myth of the invincibility. But we know from our research and others that young adults really value health insurance. A Kaiser study from June found that three-quarters of young adults say that having health insurance is very important to them. So we know that young adults want and value health insurance, but they haven't been able to afford it in the past. And that's why it's so important, and what we're doing really is to let them know that financial help is going to be available to them, that you can choose a plan that fits your budget, and you do get financial help based on a sliding scale based on how much you make. So I think that's going to be really attractive for young adults, and we do know that young adults are interested in having health care coverage.
Some analysts say the debate over striking Syria over chemical weapons use is taking time and attention away from efforts to assure that needed funding for Obamacare does come through or doesn't become the lever in a government shutdown. What does your analysis indicate?
I think no matter what happens with a government shutdown or, other congressional action, our organization and many others who are working on this enrollment effort are full steam ahead for October 1st and really dedicating all of our, time and energy towards this mission, which is to bring the uninsured, into the marketplace and to let them know that they can choose a plan that fits their budget and their needs.
Jessica Brown is Enroll America Director of Communications.
Here's a quote from the news. He took the coward's way out. That was Elise Cintron, a former neighbor of Ariel Castro, sentenced to life in prison for holding and abusing 3 Cleveland girls for 10 years after he hanged himself in his cell.
Next, 10 years since Johnny Cash died. My Father and the Man in Black, a new documentary for your ears only.